So, a blessed and wonderful day to all of us. So, may God's guidance and protection be upon us always. So, this is the second part of our presentation, or the second part of our topic on the physical examination of the reproductive system. So, before we proceed with our discussion, again, let me present to you this disclaimer slide. Okay. Okay. So again, so this is the title of this presentation, a continuation of our topic on the reproductive system. And these are the learning objectives. This has been mentioned or discussed in the previous or in the first part of this presentation. Okay, so let us now proceed to the male reproductive system. So let us have a review first on the anatomy and physiology of the male reproductive system. So the shaft of the penis is formed by 3 columns of vascular erectile tissue. The corpus is spongiosum, okay, here, containing the urethra and the 2 corpora cavernosa. Okay, and then the corpus spongiosum extends from the bulb, okay, of the penis to the cone-shaped glans with its expanded base or corona. Okay. So, in uncircumcised men, the glans is covered by a loose hood-like fold of skin called the prepuce or foreskin, where smegma or secretions of the glans may collect. So, the urethra is located in the ventral midline of the shaft of the penis. Okay. Urethral abnormalities may sometimes be felt here. Okay. So the urethra opening or the urethral meatus opens into the vertical slit like urethral meatus that is located somewhat ventrally at the tip of the glans. Yeah. So the testes are a paired ovoid glands containing primarily of seminiferous tubules and interstitial tissue. This is covered by fibrous outer coating, okay, known as the tunica albuginea. Yeah. So the testes are normally 1.2 to 1.5 to 2 cm in length for pre-pubertal boys and 4 to 5 cm post-puberty. Usually the left testes lies lower than the right. Okay, so the testes produces spermatozoa and the testosterone. So the scrotum. So let's look at the scrotum. The scrotum is a loose, wrinkled pouch divided into 2 compartments, each containing a testes or testicle. Covering the testes, except posteriorly, is the serous membrane of the tunica vaginalis. On the posterolateral surface of each testis is the softer, comma-shaped epididymis. Yan. Okay, consisting of tightly coiled tubules, yan, emanating from the testes that become the vas deferens. So, yan. So the epididymis provides a reservoir for storage Okay, maturation and transport of sperm from the testes to the vas deferens. Okay, during ejaculation, so the vas deferens, which is a cord-like structure, transports the sperm from the tail of the epididymis along somewhat circular route to the urethra. So the male sexual function depends on the normal level of testosterone, the arterial blood flow from the internal iliac or artery to the internal pudendal artery, so and its penile artery and branches. So the erection from venous engorgement of the corpora cavernosa results from two types of stimuli. Okay, the visual, auditory, or erotic cues trigger the sympathetic outflow from the higher brain centers to the T11 through lumbar 2 levels of the spinal cord. And the second one is the tactile stimulation that initiates sensory impulses from the genitalia to the S2 to S4 reflex arcs and the parasympathetic pathways through the pudendal nerve. So both sets of stimuli appear to increase the levels of nitric oxide and cyclic guanosine monophosphate or GMP, resulting in local vasodilation. So, same with a female reproductive system, the male reproductive system also has the lymphatics that drain from the pennies or passes primarily to the deep inguinal and external inguinal nodes. Okay, so the testes drain into the abdomen. Hernia among men or male client are relatively common. Therefore, it is important to understand the anatomy of the groin. So the basic landmarks are the anterior superior iliac spine, the pubic tubercle, and the inguinal ligament that runs between them, which are actually readily identified. So the inguinal canal, which lies medial to and approximately parallel to the inguinal ligament, okay, forms a tunnel for the vas deferens. Okay, so the exterior opening of the tunnel, which is the external inguinal ring, okay, this one is a triangular slit-like structure palpable just above and lateral to the pubic tubercle. So the internal opening of the canal or the internal inguinal ring is approximately 1 cm above the midpoint of the inguinal ligament. Okay, so indirect inguinal hernias develop at the internal inguinal ring, okay, here, okay, where the spermatic cord exits the abdomen. On the other hand, the direct inguinal hernia arise more medially due to weakness in the floor of the inguinal canal, and they are associated with straining and heavy lifting. That's why, ina-advise, lalo na yung mga male natin na nagbubuhat, to wear a supporter. Okay, so let us now proceed to the health history of the male reproductive system. Please take note now, as a nurse or as a student nurse, you must take note the following common or concerning symptoms such as the sexual preferences and the sexual response, the penile discharge or lesions, scrotal pain, swelling or lesions, and if there is any problem with urination. Okay. For sexual preference and gender identity, as a nurse or as a student nurse, you must reflect on your personal biases, okay, that you may have as you conduct your interview. And make sure to use neutral, non-judgmental questions about sexual and or sexual orientation and gender identity. For example, you can ask questions such as, are you dating currently, or are you sexually active or in a relationship? How would you identify your sexual orientation? Those are just examples. And you can ask more questions similar to the questions that we ask, no, or that we discuss in the reproductive system of the female. Okay, so you have to pose neutral question about sexual orientation and gender identity, and continue with how would you describe your gender identity as mentioned. Okay, so for sexual response, as a nursing student or as a nurse, you can explore on the patient's sexual response by, for example, asking your patient a question like, how is sex for you? And then you have to explore psychological and physiologic dimensions. For example, how is your current relationship? Okay, so you have to assess libido also. Maybe you can ask your patient, so how about your ability to perform sexually? Same question in assessing arousal phase. Yan. You can assess various aspects of the situation and relate questions to phase of orgasm and ejaculation. For example, what about your ability to perform sexually? Or are you satisfied with your relationship and your sexual activity? Okay, so try to determine if problem involves pleasurable sensation or ejaculation or both. So you can also ask questions like, has your partner ever hurt you or forced you to have sex? Or are you comfortable with your partner's sexual practices? So those are examples. Okay. So for penile discharge or lesions, okay, you can ask or you can assess for the possibility of genital infection from sexually transmitted infections. You can ask your patient like questions like, have you had any discharge, leaking, or dripping from pennies? What are the color, thickness, and how often? Okay, if of course present itong discharges. So you can continue asking, is there a source or growth on the pennies or scrotum? Had the symptoms before, or have you had the symptoms before? Are you sexually active? Or you can ask about sexual activity. You can also ask about past history of sexually transmitted infections, and you can also ask the client if she or he is practicing oral or anal sex. Or you can ask your client if you have any concerns about HIV infection. Okay, so if the patient complain of pain or swelling in the scrotum, you can follow the old card mnemonic to gather thorough information. Of course, by asking the sudden onset of the scrotal pain, or what is the onset? Is it sudden? Okay, which may indicate torsion of the testicle. which is actually an emergency. Okay, or is there painless, or a painless lump could be a sign of cancer. So you can ask the patient if he performs a self testicular examination. Okay, so inguinal pain or swelling may indicate inguinal hernia. So these hernias may be unilateral or bilateral. So you can ask the patient to point to the area of pain. Okay, and then you can ask the patient to describe the pain, and you can also ask, when does it hurt? Okay, is it continuous, or is the pain continuous or intermittent? Is it achy or sharp? Okay, does it occur with lifting, standing, bending, and bearing down? That could be a sign of inguinal hernia. So, moving on with the problems with urination. Okay, the prostate gland wraps around the urethra. So, if the gland enlarges due to benign prostatic hyperplasia or cancer, the patient may experience urinary symptoms. So, these are common for men older than age 70 are at greatest risk. Therefore, the nurse should review the pattern of urination. Okay. So, is there difficulty starting or stopping urination? Weak ba yung flow? How often? Okay. Umihi in the day or in the night? Nagigising ba sa gabi? Para ilang beses nagigising sa gabi to urinate? Is there any blood in the urine? Is there any discomfort or heaviness? Alright, so let us have a practice question. Okay, to review or to check if you are able to remember or apply what you have learned. Okay, so dysuria, nocturia, and dribbling are all symptoms commonly associated with which of the following? Okay, BPH, hydrocele, inguinal hernia, STIs. Okay, so I'll give you 5 seconds. Alright, this is the correct answer. Okay, the correct answer is A, BPH. BPH or benign prostatic hyperplasia is the benign enlargement of the prostate. This restricts the urethra and the patient may experience dysuria, nocturia, and or dribbling. So if you got the correct answer, congrats! Okay, so let us now proceed to the physical examination of the male reproductive system. Let's start with the pennies. Okay, so the first cardinal technique that we will use in the physical examination of the reproductive or male reproductive system is inspection. So you have to inspect the skin on the ventral and the dorsal surface and the base of the penis for any excoriations or inflammation. You may need to lift the penis if it is necessary. So check for the prepuce. You may need to retract to inspect the glands if the prepuce is in place. So you need also to inspect the location of the urethra. Now moving on to the scrotum and its contents. So again, you can inspect the skin. You can lift the scrotum to inspect posterior surface. You inspect for scrotal contours at the inguinal areas. Check for any epidermoid cyst which is usually common and benign. Okay, so this is an example, or this image is an example of abnormalities of the penis and the scrotum. We have here hypospadias, which is actually a congenital displacement of the urethral meatus to the inferior surface of the penis. There is a group that extends from the actual urethral meatus to its normal location on the tip of the glans. Okay, and another abnormality here is the epispadias, wherein the urethral meatus is located on the top of the glans at the dorsal side. This condition is a congenital defect and it occurs rarely. So another abnormal findings of the penis, we have carcinoma of the penis. So this is the illustration. It is an indurated nodule or ulcer that is usually non-tender or painless. So limited almost completely to men who are not circumcised. So therefore, dapat talaga, importante talaga magpa-circumcise. It may be masked by the prepuce, or any persistent penile sore is actually suspicious. So this is another abnormality, no? Scrotal edema or scrotal hernia. This is usually an indirect inguinal hernia that comes through the external inguinal ring. So the examining fingers cannot get above it within the scrotum. So you can see, no, ito yung intestinal contents. Ayan, pumasok na siya sa scrotum. Kaya lumalaki yung scrotum. So I have an experience in the operating room wherein merong nagkaroon ng scrotal hernia na in just a span of few hours, parang according to the history of present illness, no, few hours na bigla siyang lumaki talaga ang scrotum, as big as a head of a child. Okay, so we have another abnormalities of the penis and scrotum. So we have here the hydrocele, which is a non-tender, a fluid-filled mass within the tunica vaginalis. It transilluminates, and the examining fingers can palpate above the mass within the scrotum. And another abnormality here is the scrotal hernia, which is usually indirect inguinal hernia that comes through the external inguinal ring, so the examining fingers cannot get above it or above the mass. Okay. So these are examples of sexually transmitted diseases in male genitalia. So we have here genital warts. Okay, so look at this, no, kung anong itsura ng genital warts. So the appearance, usually single or could be multiple, as you can see in this picture. So there could be papules or plaques of they could be in variable shapes. It could be round, okay, could be thin and slender, maybe raised, flat, or cauliflower-like. Kita na kayo ng cauliflower, di ba? So the causative organism are human papilloma virus or HPV. So another, okay, here is the genital herpes simplex. Okay, the appearance is a small, okay, scattered or grouped vesicles. Okay, 1 to 3 millimeter in size on glands or shaft of the penis. Appear as erosions if vesicular membranes breaks. Okay, the causative organisms is or usually the Herpes simplex virus 2. Okay. So another abnormality or sexually transmitted disease, so male. So dapat ingat na talaga, no? Dapat isa lang sexual partner. Okay. Another is the primary syphilis. So look at this presentation, the appearance. No, there is a small red papule that becomes a chancroid or painless erosions up to 2 cm in diameter. So the base of the chancroid is usually clean, red, smooth, and glistening. So the borders are raised and indurated. Okay, so this chancroid usually heals within 3 to 8 weeks. The causative organism is Treponema pallidum. Okay, so another abnormality is the chancroid. The appearance is, okay, look at this picture, no? The appearance is, there is a red papule or pustule initially, then it forms into a painful deep ulcer with a rag, non-indurated margins that contains a necrotic exudate. Okay, it has a friable base. The causative organisms is the Haemophilus ducreae. Okay. Okay, moving on to the abnormalities of the testes. Okay, we have here the cryptorchidism. So in cryptorchidism, the testis is atrophied and lies outside the scrotum in the inguinal canal, abdomen, or near the pubic tubercle. It may also be congenitally absent. Okay, so as you can see in this picture, there is no palpable left testis or epididymis in the unfilled scrotum. Okay, so cryptorchidism, even with surgical correction, markedly raises the risk for testicular cancer. So another here is the small testes. Okay, in adults, testicular length is usually greater than 3 or equal to 3.5 centimeter. So here, the small firm testes usually greater than or equal to 2 cm suggest Klinefelter syndrome. Okay. So, to continue with the abnormalities of the testes, we also have acute orchitis. So here, the testis is acutely inflamed. It is usually painful, tender, and swollen. So it may be difficult to distinguish from the epididymis. So the scrotum may be reddened, okay, or namumula siya. This is usually seen in mumps and other viral infection that is usually unilateral. So another abnormalities is the tumor of the testes. Okay, usually appears as a painless nodule, as you can see. Any nodule within the testis warrants investigation, of course, for malignancy. Okay, as testicular neoplasm grows and spreads, it may seem to replace the entire organ. So the testicle characteristically feels heavier than normal. So this is the presentation of early tumor of the testes and the late presentation of the tumor of the testes. Alright, so let's continue. So we have another abnormalities of the epididymis and the spermatic cord. So we have here the spermatocele and the cyst of the epididymis. Okay, there's a painless, movable cystic mass just above the testes. It suggests a spermatocele or an epididymal cyst. So both transilluminate. So the former contains sperm and the latter does not. Okay, this one. So varicocele of the spermatic cord. So varicocele refers to varicose veins of the spermatic cord, usually found on the left. It feels like a soft bag of worms in the spermatic cord above the testes. Okay. So another abnormality of the epididymis is we have here acute epididymitis, okay, which is a clinical syndrome causing pain and swelling and inflammation of epididymis. So, and it usually lasts for more than 6 to weeks. So sometimes this is, or sometimes a testicle is also involved, and that condition is known as epididymoarthritis. So another example here is, or another abnormality of the epididymis is the torsion of the spermatic cord. So there is, or the testicular torsion usually occurs when the testicle rotates. That causes a twisting of the spermatic cord. So that brings the blood to the scrotum. So yun yung function ng ating spermatic cord. So the reduced blood flow dahil na ano siya, na twist yung spermatic cord, this reduced blood flow can cause a sudden and often severe pain and swelling. Okay. With that, let us now continue with the physical examination. So, if the patient has complained of a bulge or pain in his lower abdomen, especially during lifting or straining, he should be examined for hernias. So, first, we have to do the inspection. Okay, by looking at kung meron bang enlargement of the scrotum. Check for the inguinal and femoral areas kung may bulge. You can do a Valsalva maneuver. So if the bulge is present, you can refer the patient to a physician or advanced practitioner for follow-up. So absence of bulge does not guarantee that the patient has no hernia. So absence of a hernia, difficult to assess in obese patient. So if suspicious, you can refer your client to the physician. Okay, so this is just another course presentation and differentiation of the hernia in the groin. So this is the internal inguinal ring. Okay, this shows the course and presentation of femoral hernia that occurs here. Okay, so this is the inguinal canal. Okay, so course and presentation of direct inguinal hernia enters here. Okay. Yan, yung mga presentation of indirect inguinal hernia. Ito naman siya. Dito mo makikita yung bulge. Okay? Alright. Okay, so ito lang ay a continuation dun sa ating presentation in the previous slides. Okay, so the first image here is the indirect hernia, which most common, that appears in all ages and both sexes. Could appear in both men and women. So this is often in children that may also occur in adults. So the point of origin is just above the inguinal ligament. Near its midpoint, the internal inguinal ring. So the hernia is often into the scrotum. So the hernia comes down the inguinal canal and touches the fingertip. Okay, the second picture is the direct hernia, which is less common, usually in men, or usually appear in men older than 40. So it is rare to appear in women. So it's just located in just above the inguinal ligament, close to the pubic tubercle. So near siya sa external inguinal ring. So it rarely appears into the scrotum. So the hernia bulges anteriorly in this portion only and pushes the side of the finger forward. Another example of, or another type of hernia is the femoral hernia, which is least common. This is more common in women than in men. So it's located just below the inguinal ligament that appears more lateral than an inguinal hernia. Can be hard to differentiate from lymph nodes kasi maliit lang siya. It never goes into the scrotum because again, this is common among women. So the inguinal canal here is empty, so not affected. Now let's proceed with the recording of your findings. So recording the physical examination for male genitalia and hernias. Of course, in doing your inspection, okay, your focus, of course, the skin, the color of the skin, or if the patient is circumcised or not. Okay, is there penile lesions, masses, discharges, is there swelling and pain? Okay, so this slide shows an example of how you document your finding. For example, circumcised, no penile discharge or lesions, no scrotal swelling or discoloration, the testes descended bilaterally, no apparent inguinal or femoral hernias. Of course, after gathering all those data during your health history and physical exam, so it's now time for you to create your health teaching or your plan, no? And part of it is the health promotion and counseling. So the important topics for health promotion and counseling includes the following: prevention of sexually transmitted infections and HIV, testicular self-examination or TSE, screening for prostate cancer. Okay, for prevention of STIs and HIV infection, the Institute of Medicine calls STIs hidden epidemic of enormous health and economic consequence in the United States. So the growing burden of STIs affect health of all, but especially the adolescents and the young adults. So screening recommendations. So the nurses should master the skills of eliciting sexual history. The key information for sexual orientation includes the following: the number of partners in the past months, particularly in the past 6 months, history of past STIs, alcohol and drug use, especially those illicit drugs, the general risk reduction. So important topics again is limiting number of partners. Okay, dapat iisa lang ang partner. Using condoms or dental dams, establishing a regular medical care, and seek prompt attention for any genital lesions or penile discharge. So, screening recommendations, screening for 15 to 65 years old and all pregnant women, okay, should have screening. Universal HIV testing from 13 to 64 years old, prenatal testing of all pregnant women. So the Centers for Disease Control recommends opt-out approach to HIV testing. And the American College of Physicians recommend extending screening up to 75 years old. Okay, annual testing recommended for high-risk groups, especially to those who are sexually active or sex workers. Presence of any STI warrants testing for co-infection with HIV. So you have to encourage all patients to seek prompt attention for any genital lesion or penile discharge. Okay, address preventive behaviors as follows. Okay, you have to correct use of condoms and dental dams. You have to teach them the proper way of wearing it. And of course, instruct your patient to limit sexual partners. This is again and again, no? And regular health care for STIs and HIV. Okay, so part of the health promotion and counseling is the HPV vaccination or the human papillomavirus vaccination or vaccines. Okay, so the HCIP recommends routine quadrivalent HPV vaccination in males ages 11 or 12 and through age 21 if not vaccinated previously. So for those who are immunocompromised or having sex with other men, so dapat at age 26 din, no? At HPV vaccine. So you have to inform your patient that HPV vaccination can prevent HPV-related diseases in males. So it could possibly reduce HPV transmission to female sex partners and lower risk of oropharyngeal cancers. Okay, so you have to include in your health promotion and counseling also the importance of testicular self-examination. Okay, the common ages who develop cancer are those ages 15 and 35. So if detected early, so there could be an excellent prognosis. Okay, and these are the following risk factors, no, na mas kailangan nilang mag-testicular self-examination, especially those who have cryptorchidism or isa lang yung testes, or those who have history of carcinoma in contralateral testicle, okay, or naka-experience ng mumps or orchitis, those who have inguinal hernia, hydrocele in childhood, and those with family history. Okay, encourage monthly self-examination and seek physician evaluation for the following: if there is a painless lump, swelling, or enlarge in either testicle, pain or discomfort in the testicle or scrotum, feeling of heaviness or sudden fluid collection in the scrotum, dull ache in lower abdomen or groin. So those are the patient instructions for doing the testicular self-examination. This can also be found in your book. So it's important that you will read this one and understand so that you can share it with your patient, or you can teach your patient how to properly perform testicular self-examination. And of course, if you're a male, you can practice this one, or you can teach your family and relative member. So another or part of the health promotion again is the prostate cancer. Okay, you have to give information to your patient or group of patients that prostate cancer is the leading cause of death among men. So it's important na i-monitor ito. So the primary risk factors include the following: the age, no, especially it increases no after 65 years old. Ethnicity, this is higher in African Americans. Family history naman, 5% to 10% of men diagnosed with affected first-degree relative. So for diet, possibly intake of dietary fat, especially saturated fats and fats from animal sources. But evidence remains inconclusive. Alright, so to continue, importante rin ito, no, for those men with symptoms of prostate disorders should be referred to, of course, urologists. Okay, lalo na if they're experiencing the following: merong incomplete emptying of the bladder, so parang kakaihi lang, parang hindi naubos, or urinary frequency or urgency, pabalik-balik, no? Weak or intermittent stream or straining to initiate flow. There is blood in the urine, nocturia, so ilang beses umihi sa gabi. Bony pain in pelvis. Alright, so that ends our presentation for this week. And this is the reference. Alright, so before I end this presentation, let me again share to you this verse from Luke chapter 1 verse 37. For with God, nothing shall be impossible. So just pray and do and give your best. And God will do the rest. Kayang-kaya nyo yan. Konti na lang. 2 more topics for next week. And then, after that, final exam na. And, of course, magkakaroon na kayo ng vacation break after ng inyong RLE. Thank you, everyone, and God bless.